Hi, everybody. I know some of you are still rolling in, but I'm going to get started. So hello, and I want to welcome all of you to the Salient Healthcare presentation on the value of performing annual wellness visits and how to take advantage of this excellent opportunity using the Salient solution. Presenting today from our team are Amy Kotch, and she is our team lead and a senior business consultant. We have Maria Nikol, and she's another of our senior business consultants, and she's an expert on healthcare policy. And I'm Ryan Mackman, and I'm one of Salient's business consultants, and I am the user engagement lead. So managing a population's health is no easy task. Whether you're an ACO, a clinically integrated network, you focus on Medicare Advantage, or you're another type of provider organization, sometimes it can feel like juggling while riding a bike. And because of that, trying to achieve shared savings in value-based care can be really elusive. So what can a provider organization do, or where can they even find the starting line so that they're on the right path? There's no magic bullet, but there is a way to give yourself a really good head start, and that's performing annual wellness visits. By performing more AWVs and tracking your progress with the Salient Healthcare dashboards, you're making sure that your care team is proactive instead of reactive. So this informational session is going to teach you the importance of performing AWVs, followed by a use case on how to use the Salient Healthcare dashboards in order to track the efficacy of the AWV initiatives that you plan to implement or have already implemented.
All right, so now we're going to talk about the why. And before we get into the process of how performing annual wellness visits will lead you towards success in your value-based programs, I want to talk about why it works. There are 5 main categories that have to be satisfied for your organization to meet financial and quality goals. And those categories are in the upper left-hand corner that Ryan just circled in red. It's finance, risk, quality, attribution, and utilization. All 5 are tracked in the Salient Healthcare dashboards, and we pull in monthly claim and claim line feed data, also known as the CCLFs, and utilize the CMS data sources to generate the big picture. And we can also incorporate your clinical data for care gap closure as well. But focusing your organization on annual wellness visits is going to be a great start because of the domino effect it has on all 5 of these categories. According to 2017 survey results from the Administration on Aging, only 45% of people age 65 and over consider their health to be in excellent or very good standing. Additionally, the percent of the total population having a disability or multiple chronic conditions increases with age exponentially. So, because the wellness visit, as indicated in the name, aims to prevent illness and control chronic conditions, patients are finding this visit to be quite beneficial for their overall sense of well-being and strengthens their relationship with their provider. The wellness visit does a complete health risk assessment and seeks to spark conversation with the patient on their overall health rather than a subset that may just be bothering them today. This is not meant for acute discussions of health, but rather discuss medical history, family history, and the chronic conditions the patient faces throughout their lives. The ultimate goal of the wellness visit is to develop and continuously edit a personalized care plan that's filled with shared decision-making. And I want to emphasize that word, shared decision-making, because it's used in the caps, so that your patient and provider can act as a team to keep them healthy and out of acute care as best as possible. Users of the Salient Healthcare dashboards can view their wellness visit completion rate as soon as they log in. It's actually located in the lower right-hand corner that's circled in red, and that's a year-to-date view. If you have a different preference of viewing it on a rolling 12 months, Salient can also track that for you on the annual wellness visit opportunities dashboard. And you'll see that here in the upper left-hand corner. Salient recommends keeping the wellness visit completion rate above 70% for maximum impact. So you can see that threshold written in here as well. It is important to note that previously low-scoring provider organizations only need to show improvement year over year to make an impact on the overall performance, but it's also important to keep that 70% goal in their minds. Now, there are actually two different types of wellness visits that we want to discuss, and both are paid for by Medicare. You have the classic wellness visit that we've been discussing, and then you have the initial preventative physical examination. That's the IPPE. And that's a review of medical and social health history, as well as preventative services education. The IPPE is only covered one time as a Medicare benefit, and it has to be completed within 12 months of Medicare Part B enrollment.
So let's take a look at who benefits. Well, the answer is the patient, the provider, and those managing population health. There's a cascading effect that happens when medical practices are regularly performing annual wellness visits. The patient benefits because they receive an annual comprehensive evaluation focused on overall wellness and prevention at absolutely no cost to them since there's no copay. Ultimately, patients less spend time in the hospital and have a better relationship with their physician. This often leads to increased trust and safety, which results in greater overall patient satisfaction. It's nice the patients are happy, but what about the providers? Well, they win too because of the increase in quality metrics. Oh, and they make more money too. With the average AWV reimbursement at $111 per beneficiary, a practice with 2,500 beneficiaries that increases their AWV rate from 25% to 70% stands to make almost $140,000 in additional sustainable revenue by performing AWVs. Your provider organization ultimately benefits as every single quality metric improves. It should be noted that AWVs address more than a quarter of GPRO measures. They reimburse at a higher rate than an E&M visit, and they help to develop a better patient-physician relationship. Working backwards from the 5 categories that we mentioned previously, the trickle-down effect of performing annual wellness visits first starts with utilization. Beneficiaries who see their primary care provider annually have lower instances of ER visits. Also, at the end of each AWV, the physician's offices have the ability to schedule follow-up appointments. This ultimately bolsters attribution and lowers churn. Quality is also improved as care gaps are closed, which will likely lead to increased frequency in the hemoglobin A1Cs, more frequent flu shot administration, and increased mammogram appointments. Risk becomes more stable because follow-up visits leads to more accurate coding. Also, patients with high risk scores due to uncontrolled chronic conditions can be managed. Finally, all of this leads to an improvement in the financial category because a positive impact on the other 4 categories typically leads to overall spend that's decreased for each provider organization year over year.
Now that you realize the impact of performing annual wellness visits, this is where the real fun begins. We're going to use the Salient Healthcare dashboards and find out the who, what, when, where, and why of AWVs. The old cliche of what gets measured gets managed is going to get put into full effect right now. So keep in mind, this use case has all demo data, so rest assured, no PHI is being disclosed. And the purpose of this short use case is just to discover the frequency of beneficiary annual wellness visits, as well as which beneficiaries have not yet had them. So here you're looking at the landing page. Now, simply navigating to the AWV opportunities dashboard from our quality navigation bar, that's going to enable us to visualize organizational performance, on a rolling 12-month basis. Now remember, as Amy said, the goal is to reach approximately 70%. So immediately, this is a great visual aid for annual wellness visit completion. Now, in addition to tracking current performance, this specific dashboard also provides users with an actionable list. Now, this actionable list may be used by practice managers or other office personnel, and that's to help ensure proper scheduling. In fact, using the filter panel, we can open that up, and that gives you the ability to filter out by practice, by provider, or by payer. You also have the ability to share this. Once it's filtered, you can either use a link so that other users of the Salient Healthcare dashboards can connect to this link, and then they'll be able to see the same list that you're looking at, or you have the ability to export. You can export in either a Microsoft Excel format or a CSV, and you can print that list off, and you're going to be able to then hand that to the providers or to the practice themselves to bring those patients in.
Thanks, Ryan. So now that you understand how to measure your wellness visit performance, it's time to discuss the components of the AWV. The first component is understanding the who. Who can perform this visit? Well, a physician certainly can, but you may have a mid-level provider or a group of medical professionals complete this visit as long as they are directly supervised by a physician. The second component is the what. What does the AWV consist of? The first component is the Health Risk Assessment, or HRA, a survey used to identify health information, biometrics, risks, and habits. Then the next piece is the establishment of the beneficiary's medical and family history, followed by a current understanding of the specialist the beneficiary has been seeing, along with their preferences. Now, if a patient doesn't have a preferred specialist, this would be the optimal time to provide them with a list of preferred providers. Lastly, it's beneficial to provide the patient with a written screening schedule so that they're aware of how often they'll need to visit the doctor. And by pre-scheduling appointments, you're ensuring that they will return on a regular basis to follow through with the established care plan. Throughout each subsequent visit, providers will continuously identify risk factors and other conditions as they present themselves. And for most Medicare patients, it's recommended to discuss advanced care planning to ensure proactive efforts, even if it may be a sensitive subject. It is important to note that the wellness visit is not, and I repeat, not a physical exam, and that could be confusing to many of your new patients. So you need to set clear expectations right up front. And it's important throughout the entire process to ensure patient satisfaction. And I'll bring up that CAP survey one more time, that they're going to be completing this at the end of the year. So you really want to ensure patient satisfaction and communications are all set up.
So let's talk about getting started with an annual wellness visit initiative. If your provider organization is new to developing the AWV initiative, it's important to note that you'll need significant buy-in from your practices and providers. If a practice hasn't been performing AWVs regularly, asking them to change the process is going to be a really difficult proposal. Asking for a 5 to 10% increase each year is a much more manageable goal to set. It's recommended to have the office managers utilize the actionable list that Ryan showed earlier to begin outreach via phone call or patient letter in order to notify those beneficiaries that they're overdue for a visit. Reminding patients within 24 hours of their appointment is good practice, since everyone can be a bit forgetful at times. After completing the AWV, it's important to follow up with your patients to ensure that they feel they've been taken care of. A little extra contact often goes a long way towards endearing a patient to a provider. Finally, don't forget to have the office staff properly bill for the AWV by using codes G0402, G0438, or G0439. As a reminder, use the 25 modifier for any additional services rendered.
Okay, so we've covered a lot of information regarding annual wellness visits, but that's really not everything. If you're looking for more information, Salient also provides our clients with a resource library, and you'll find additional annual wellness visit documentation along with workflows, and also a copy of this presentation that we're doing today. Now, speaking of clients, I'd be remiss not to mention that we also offer a 45-day risk-free trial whereby we allow you to test drive the Salient Healthcare solution, all with your own data. We can get you up and running in as little as just 2 weeks. Now I'm going to open up the floor for a brief Q&A session, and the three of us are going to stand by to answer any questions that you may have. So I have one question coming in right now, and it looks like this one is directed at Maria. So it says, you mentioned that there's specific codes to the annual wellness visit. Can you please go over those again?
Yeah, absolutely. So those codes are G0402, G0438, or G0439. And remember, you're going to use the 25 modifier for any additional services that are rendered on the same day as the annual wellness visit.
Great, thank you. Looks like we have another question here. It says, is the annual wellness visit different than the welcome to Medicare visit?
Hi, Ryan, this is Amy. I'll take this one. So I covered that in one of my slides. The welcome to Medicare is that IPPE, and that's the initial preventative physical exam. And that's a one-time benefit. So you're supposed to do that one first, and then all your subsequent wellness visits that you do on an annual basis are going to be different. So that'll be your regular annual wellness visit.
There's another one here. It says, do I have to wait literally a year to the day, or can I just do it January 1st the following year? So I think that this question is geared toward how frequently you can do the annual wellness visit. And there's kind of two answers to that. So when these codes were enacted in 2011, Medicare clarified the exact time frame between visits. So AWVs are covered by Medicare at 12-month intervals, and that means that 11 full calendar months must pass after the month in which a beneficiary had received an AWV. So under this method of counting, a beneficiary could receive an AWV at the end of a given month, for example, January 2011, and then the following January 2012, the beneficiary would be eligible for an AWV in the beginning of that month. So a full 365 days would not need to elapse between visits, provided that 11 full months had passed since that last visit. So with that in mind, your November 3rd, 2018 G0439 would be covered. However, depending on your location, Medicare has been known to deny a subsequent AWV before the 365th or 366th day between them. So you need to find the specific regulation or payment policy that your Medicare administrative contractor follows. We've got another question here. So can Salient also address care gaps?
Sure, so I'll pick that up. This is Amy. So when you talk about care gaps, there's different ones, and they could come from different domains or data sources. And Salient is able to ingest all different data sources. Our base package ingests the claim and claim line feeds. So all of those different codes that you see, all the CPT codes, are available here. And we do provide actionable lists, for example, for flu shots, pneumonia vaccines, mammograms, colorectal exams, and the list kind of goes on from there. If you do want to integrate your clinical data from your EHRs, we'd be able to do so as well. And then that would provide a little bit further insight on some of those quality metrics that you need to complete by the end of the year.
Another one, this is more toward incentives. So the question is that a lot of the providers are worried that doing annual wellness visits is a lot of work, and they want to know how they can incentivize their practices to perform more annual wellness visits.
Sure, I'll take this one, Ryan. So it's a team-based approach. So the providers are not necessarily doing the entire work of the annual wellness visit, but we encourage the entire office to jump in and make sure that these are done. I also wanted to reiterate the points that Amy had made previously regarding the fact that it generates additional fee-for-service revenue, and it really addresses a lot of the quality metrics and builds the patient-physician relationship. So it's really important to get these done, as it really kills multiple birds with one stone.
And it looks like we have one last question, and thanks, Maria. So this one says, if you're completing an AWV and you're a pharmacist, can I do it independently, or do I need to be supervised by a physician? So I can take this one. So yes, your annual wellness visit has to be completed under the supervision of a physician, and that has to be an MD or a DO. And my wife is actually a dietitian, and technically they're allowed to perform AWVs, but she would have to then be under the supervision of a physician. And it looks like that is it for questions. So thank you, everybody, for watching this presentation by Salient. We really look forward to continuing to help you navigate these ever-changing waters of value-based payment. You can visit our website at www.salienthealthcare.com, or please feel free to contact any of us. All of our contact information is listed right here on the screen. So again, thank you, and we look forward to speaking to you soon.